One of the things we've seen over decades, really, is that healthcare organizations have put a tremendous amount of effort into automating the key processes, capturing the key data that they need to capture. And that was necessary, but it hasn't really delivered the value that CIOs and hospital CEOs are looking for from IT. So today, when we talk to our customers, when we talk to pace-setting organizations, they are focused on making much wider, much more effective use of the information they collect, really finding the insight that exists in that data and using it to improve the delivery of care, improve the efficiency of care, improve the effectiveness of care. And that, I think, is really what's driving attention on a next-generation approach, on a platform approach to healthcare IT. And we see a clear evolution from the early stages of capturing information to a focus on sharing that information among departments, among organizations, to now looking at how the information can be used to improve and optimize everything that goes on in healthcare. And that's really where a platform is key. Well, when we talk to customers about informatics and we try and understand, their aims and the areas where they have felt in the past the technology was lacking, it really focuses on two things. One is the need for immediate access to data. So much of the effort in the past has gone into after-the-fact analytics, looking at data that's days old or weeks old or months old. And in order to really improve care and deliver the information that's needed at the point of care, we need immediacy. We need to provide real-time access to the core key data. The other dimension that we hear about all the time is the need to unlock the textual information, the unstructured data. A lot of attention has been paid to making better use of the structured information. But for most healthcare organizations, that's 5 or 10%. Most of the information is included in doctor's notes and in other kinds of text that's not accessible through informatics solutions. So what we see is clearly an important dimension to the next generation of healthcare informatics is unlocking this unstructured textual information. Informatics is not something that's new. There have been approaches and solutions for informatics for a long time. I think their success has been limited for a few reasons. One is they tend to be after the fact. They tend to deal with data that's days or weeks or months old. They also ignore the 90 or 95% of the data that exists in medical records in textual form. That's where a lot of the core information lies, and that's really been outside the bounds of informatics solutions in the past. I think one of the real challenges in implementing a healthcare informatics solution is connecting effectively to all of the systems and all of the kinds of data that are needed to make it work. Increasingly, those systems are not just within one hospital or within one organization, but they extend out into the community. So I think one of the keys in thinking about this technology in a strategic way is to understand that it is in a state of evolution. We don't know where it's going to end up, and we need a technology base that's as flexible and as open as we can possibly get. One of the most important efforts in healthcare worldwide is to move beyond today's a very fragmented system of care and build much more connected healthcare systems. This is at the core not an IT problem. It's a much broader healthcare problem, and one that leads to great inefficiencies and great frustration for patients. IT is an important part of the solution because health information exchange can bring together the key data about a patient, make it available to a clinician that's providing care, and allow that doctor or nurse or someone else to have access to the fullest range of medical information as they're making decisions. That has the potential to increase the quality and effectiveness of care, but also its efficiency. One of the questions we often get asked is how does this healthcare informatics technology fit in with the applications an organization might have already? And for me, the easiest way to answer that question is to say that our technology is used to fill the gaps that inevitably exist between those applications and systems, to fill functional gaps, to fill informational gaps, and by filling those gaps, to make the existing systems more useful, more valuable, and to enable new solutions to be created using all the good things in those existing applications to address broader problems that are beyond the scope of any one application and that really require a kind of strategic approach. In creating HealthShare, we focused on including all of the key technologies that are required to deliver a very powerful healthcare informatics solution. It begins with three key core capabilities: information, connectivity, and insight. Information, the ability to acquire, manage, and share structured as well as unstructured data. Connectivity, so that we can connect to the widest variety of application systems, peoples, everything that exists in the world of healthcare. And insight, so that we can provide real-time quantitative and qualitative analytic capabilities. Based on those core capabilities of information, connectivity, and insight, HealthShare provides advanced analytics, very powerful standards-based data exchange, extremely flexible consent capabilities to protect patient privacy, robust security protections, terminology capabilities to deal with the wide vocabulary that's included in healthcare, and identity management capabilities to effectively identify patients, providers, and everyone who participates in healthcare. If I was asked to describe HealthShare succinctly, there's some words that come to mind. The first is powerful, reflecting its incredible wealth of capability and its massive scalability. Second is versatile, because HealthShare is designed not only to address today's needs, but tomorrow's as well. The third is easy to deploy, because we offer both on-site as well as SaaS options, so we can get customers up and running quickly. And finally, and perhaps most importantly, HealthShare delivers benefits quickly. It enables us to shorten the time between the start of a project and the realization of tremendous benefit to just a few months.